Are we ready? Good morning. Hi, thank you all so much for having me. It's exciting to be your first person for the day. I appreciate it. I wanted to sort of start out by saying that I recognize you are all here today because we want to do better. We want to do more. I think about how the gentleman that opened the day said, we need to be smarter, faster. We need to be more innovative in how we are doing our work. And so I absolutely recognize that we're all here to do that, and I think that we've got an amazing group assembled here today to be able to have those conversations. I think we also sort of understand if we do our work right today and in the days to come, healthcare is going to be very different in the future, right? We know that what got us here today is not going to be what gets us to where we want to be tomorrow and in the years to come. So I thought I wanted to do one thing with you all before we sort of get into the heart of the day. I know we're going to have a lot of time to really dig into the details of hospital design and of infrastructure planning and picking materials and finishes and figuring out what workflow is. But I wanted to take a few minutes here at the beginning of the day to just sort of step back and to actually think more expansively about what is healthcare at the end of the day? What are we trying to do, right? At the end of the day, if you really think about it, what we are trying to do is make people feel better. We are trying to make people healthier. We are trying to help them feel better about not only themselves, but about their families. We're trying to give people wonderful jobs that they feel good about. And there are certain sort of things that we as human beings need to feel good, right? So I thought I would spend a minute or two talking about what are those things? What are the conditions that we as just emotive human beings need to feel good? So I would argue that one of the things that we need to feel good is we need to feel empowered, right? We need to feel like we have autonomy of self. We need to feel like that we have the freedom to make our own decisions. I like this image because I feel like there's two stories going on here. On the one hand, you have the clinician who is clearly, on her game. She has a tool at her disposal that is brand new. She's got a sophisticated technology that's going to let her do more with her job, right? That feels good. It makes you feel competent. It makes you feel capable in what you're doing. Not unlike the clinician, this older woman who's lying here in bed, this is good for her too, right? She is learning something new. She's getting a new tool in her own toolkit. Where this particular image is sort of thinking about how we might use AI and artificial intelligence and advanced technologies to help people from a cognitive standpoint. That's a good thing. That's a good thing for both of them. They are both on their game, as it were. We as human beings also like to feel recognized, right? Like we want to be sort of noticed for who we are and for the value that we bring to the table. Again, you've got two stories here, right? One is the person who's the subject of the care, who clearly seems to feel good, is laughing at something. They are recognized for who they are. They are being cared for. The gentleman, the young person on the side pushing the wheelchair, also seems to feel like they're in their space. They are confident in the role that they are playing, and they feel good about this role that they're playing. And then lastly, I think as human beings, we all need to feel purposeful, right? There's nothing worse than sort of feeling like you don't have a purpose or that you don't have a reason for your being. Purpose is an incredibly foundational piece of how we sort of show up in the world. I don't know that you guys would recognize this woman. She was a very, very prominent human rights and disabilities activist in the United States. At about 23, she just had a terrible accident and dove off of a boat, hit the bottom of the floor under the water, broke her neck, and ended up paralyzed, right? So this young woman's life changed dramatically at that time. And she had to figure out, all right, who am I going to be? What am I going to do in the world? How am I going to be in this world in a way that I never thought I would be? And she found her purpose, right? She found a sense of motivation and direction and figured out a way to pick up those pieces and participate and really, really provide, incredible support and advocacy to people who needed her. Those are all sort of conditions, and of course we need to be happy, we need lots of things. But if you think about it, that sense of empowerment, that sense of being seen and recognized for the unique human that you are, and being, purposeful in why you're here, those are really core ingredients to being able to make good decisions, to support not only yourself, but other people around you. Which is why I think it is especially disheartening and sometimes dangerous that in some of our most dire and critical stages in life, or when things happen, that we all too often feel like those feelings are stripped away from us. I'll go into these next couple of slides saying that clearly all of us in healthcare are trying to do the right thing. Our intentions are fantastic. And we come to our work every day trying to do the right thing, but the system that we are in and the way things work now are not allowing us to be the best caregivers that we would want to be, or to be able to provide the best care that we would want. All too often, instead of feeling empowered, people feel out of control in the healthcare system. The story being told here actually, again, has sort of two facets. On the one hand, you see here a young person, an autistic patient, who had been, an emergency had been called in, they had been brought to the emergency room. This particular patient, or this particular story, this child stayed in the hospital, just a regular hospital, for over 300 days because there was no mental health facility available in the area to take them. That is not empowering this child. That is exacerbating what is already a serious condition that this person has. The flip side of this is the hospital is also not equipped to take care of this child, right? This is not what this hospital was designed to do. This hospital was designed to do trauma, to do quick treatments. It's not supposed to be a long-term health facility. So that feeling of being overwhelmed and alone on both sides is hugely impactful in how we spend our days. I think this is another one that is really difficult for so many of us who, kind of think of ourselves as the ones who gets things done and, give us a decision to make and we'll do it and we'll take care of it. Well, all too often when we're in these situations, too many people feel really helpless and as though they don't know where to turn. They don't know what's going to happen next. The communication lines are not clear. Again, everyone's doing the best they can, but the experiences are not set up in a way that we are able to help that person who needs to be the one in control and who needs to be the person feeling like they can take care of that, the one that they love. They're left sort of adrift and not able to make the kind of decisions that they best feel like they should. And lastly, I couldn't come through this section without talking about the impact that how the system works today has on all of us who are clinical, right? There is a tremendous impact on nurses, doctors, surgeons, administrative staff in trying to do the work that they do under really complicated conditions, or in places where our technology infrastructure is not working the way it should, where you're wrapped up in paperwork all day. Most of us came to healthcare because we wanted to care. We wanted to do things, not sit on the computer and type in forms and, chase down material that should be at our fingertips. So I think another piece of this is the fact that people don't have what they need is potentially exacerbating, again, the shortage of caregivers that we have. There's a study out now saying, 50% of doctors who were asked would tell their children not to go into medicine. That's a shame, right? We don't need less doctors, we need more doctors, but we need to be providing environments and we need to be providing systems that allow them to feel confident, to feel motivated, to feel purposeful and like they can do the work that they feel like they were born to do. So with that as a backdrop, I wanted to talk a little bit about what I think is an underutilized tool that we have at our disposal. Good design, and by design I mean everything from engineering to aesthetics to strategy to patient and staff experience. Design is very, very good business. Design pays off in the end in lots of different ways. And I think If we are truly in search of the quadruple aim, right, if we are trying to improve health outcomes, if we are trying to make patients and their families feel better, if we are trying to increase our staff satisfaction, if we're trying to pull costs out of this system, that's a really complex problem to solve, and design thinking at its core is simply just about solving complex problems. It is a set of tools and a set of methods that allow you to come at a problem in a very, very different and comprehensive way. So I've been in design for 25 plus years, and it's easy for me to sort of just, talk subjectively about how important I think design is. But I also wanted to give you a little bit more of an objective view of how design actually delivers on its promise. Some of you may have seen the Design Value Index before. I don't know if that's familiar to you or not, but about 20 years ago, a group from Microsoft, Motive Strategies, and an organization called the Design Management Institute came together and started trying to figure out what was it about design-centric organizations that made them outperform their peers in the market, right? What were the criteria that allowed companies like Apple or Steelcase or Walt Disney, all the ones that you see here on the screen, what were they doing that allowed them to be, over time, outperforming their peers by, 200+%, which is not an insignificant amount of betterage. And what they found was a couple of things. One, design-led companies actually embed design into all parts of their organization, right? So they do design research and they do R&D in all parts of the organization. I think for Philips, our first R&D lab was actually back in about 1917, and we have had deep R&D within our organization ever since then. Another thing that design-led organizations do is they build in designers into their executive core. So just as important as it is to have a CFO and a CEO, is it to have a chief design officer or a chief experience officer. I think a great example of this is just recently we had a chance to speak with Kevin Mabet, I believe is how you pronounce his last name. He's a gentleman who is now the chief design officer for Intermountain Health in the United States. He's been there for 2 years. Guess where he spent his last 25 years before coming to Intermountain Health? Disney, right? So Intermountain Health is thinking and banking on the fact that they need to be pulling in different ways of thinking, different competencies, and figuring out how to sort of move away from that business-to-business mentality that we've had for so long into a much more competitively paced business-to-consumer sort of environment. And I think what's probably most critical here is that, happy customers are easy customers. Unhappy customers actually cost their businesses money, right? And in healthcare, the stakes for us are way higher than somebody who's just not happy with a telephone bill or who thinks they paid too much at a restaurant, right? For us, an unhappy customer, an unhappy person is a sicker person. It's somebody who needs more help and more care. So if you look at sort of what happens when a bad experience occurs in healthcare, you are more likely to get a non-compliant person over time. You are more likely to see somebody coming back into the hospital. And as we were talking about this morning, we're not going to make money if people continue to come back. We're going to lose ground and have a much harder time running our hospitals if people keep coming back into the system. We need to get them healthy, and we need to be able to send them home. So, again, another way of thinking about design is if you figure out how to deliver excellent or very, very good experiences, you reduce your cost to serve over time. And you create healthier people and happier people as a result of that. So I just wanted to spend a moment or two talking a little bit about how Philips thinks about design and how Philips thinks about healthcare in general. And then I'm going to show you just 2 case studies really quickly that I hope leave you with some inspiration as you move forward throughout the rest of the day. So first things first, I think one of the things that has drawn me to Philips and kept me with Philips over the years is that Philips really does, we think about health as a continuum. We've been here, we've been in this hospital space for many, many, many years. We know you. We understand how the hospital works. We hopefully deliver products and services to you that make your work easier and better. We are very invested in that particular part of the healthcare system, and that's always going to be that way. But I think we're also equally as invested in, like I was saying a moment ago, figuring out how once we get you okay and move you out of the hospital, how do we take care of you once you're home? What is the link between the hospital and the home environment after something has happened, right? That means we have to be thinking about once you walk out that door, how are we keeping connected with that person, with that patient? Is it wearables? Is it continuous monitoring? Is it diet? Is it nutrition? How are we pulling information from their day-to-day lives back into the system so that we have a longitudinal understanding of how they're doing after we've treated them? Those kinds of things, those deep insights and that knowledge is going to be part of what helps us, again, sort of transform the way we're doing care now. It can't just be about what happens within the walls of the hospital. And last but certainly not least, and you set me up beautifully for this last piece as well. Philips has been in our homes forever, for as long as we've been in healthcare, right? You're screwing then Philips light bulbs. You may have Philips products in your kitchen. You may have a Philips shaver. You may have an air purifier. Your loved ones may wear a Lifeline in their older years. I think that understanding and that knowledge of how daily life works is incredibly important because, as you mentioned earlier, hospitals are going to have to start thinking a lot more about prevention and not just about acute care. If we can start figuring out how to link back into keeping people healthy in the first place before they even get to us, that's actually a good thing. We should want fewer patients, right? We should want fewer people coming to us so that we can actually treat better and do more with the ones that have to have us when they need us. So with that, just going to talk through 2 case studies really quickly. I have a million of them, but I tried to just sort of pick a couple that I thought might be interesting for you all. So this first one is a little bit about the hospital system and a very, very large hospital system, the government in the United States, figuring out how to bring care into the community, right? How do we get care out of the hospital and into the community? We were asked by the Veterans Authority, about 10 months or so, to help them figure out how to reach veterans that were not coming in for care. So their problem was they have thousands and thousands of veterans, both younger and older veterans, who don't live in places where they can easily get to a veterans hospital, who have either disabilities, be they mental or physical, that are keeping them from accessing care. A lot of these people live in very, very small towns, and it's literally 4 or 5 hours away to even get to a hospital. So their rates of chronic disease are higher. Left untreated, their conditions are worse. There is a significant population mental health issue with a lot of the veterans, and they're people just sort of without anything. So we were asked to come in and help them figure out how they could solve for this. I think the most important thing to talk about here is how we did this work. So for us, it's not enough to just sort of hear from the doctor or just sort of hear from the government. We needed to actually talk to veterans and their families and the nurses and the doctors that were there in the community to really understand what's going on. So you see here sort of a view into what we did. We actually went out to a VFW. So a VFW is basically a community location where veterans and their families will get together to have coffee or have a beer or play pool. It's a meeting ground. And we hypothesized that this would be a place where we could actually put a telehealth center. We could actually have something there that they could use for medical purposes. So we had to, you see here, we actually built one of the pods, one of the telehealth pods, and we brought in veterans and nurses and sort of walked them through a design exercise. We role-played what it would be like for them to actually come to this space and have an appointment. What would it be like to have an appointment for a medical purpose? What would it be like to have a behavioral health assessment there? How would they feel? What would they think about privacy? What would they do? What would they not? And the results were really, really fantastic. Not only did it give us tons of information that we wouldn't have had if we didn't go listen and really hear. We were able to sort of design multiple ways for the VA to support this, whether you had a pod that was freestanding if you have enough room, to what if you only have a little bit of room and you need to figure out how to do, to deliver this solution differently. And at the end of the day, I think the testimonials that we heard from people are, and the hunger people have for this is really the thing for us to hold on to. So next steps for us are to deliver on this person's quote, right? Having this service in our community would be life-changing. Being able to have my doctor here and not have to figure out how to drive 4 hours would be incredible. So we are partnering not only with the VA still, but we're looking at the other ecosystem of partners, right? Who would be some of the EMR technology player in this? How do we put together the group of people that can actually make something like this come to life? And then lastly, I'll show you one other very aspirational Philips concept that we're working on with a hospital in Florida to design the NICU, the Neonatal Intensive Care Unit of the future. Some of us in this room, I'm sure, have had experiences in the NICU, and it's incredibly stressful and can be incredibly terrifying. So our work with this hospital was to figure out what would it look like to create an environment in the future that delivers a better sense of care.
Babies born prematurely or with complications are admitted to the neonatal intensive care unit. The NICU can be a stressful environment for parents and newborns, with excessive noise and light impacting physical and neurological development. Philips is working on next-generation concepts to humanize the NICU experience through a neuroprotective family-centered developmental care model in line with the classical analog. Our team collaborated with clinicians to construct an experience lab that features key technology touchpoints integrated throughout the environment. The experience begins at the entry threshold, where caregivers can access essential data without having to disrupt the babies and families within. Upon entering, caregivers and family ensure hand hygiene via a smart sync system. Relevant patient and clinical information appears on the screen. After checking in with the baby, caregivers can access important clinical information from a context-aware, user-friendly dashboard that automates NICU workflow and supports informed decision-making. Analytics consolidate relevant clinical data from multiple devices into a meaningful format, customized for each user. Caregivers do not waste time searching for data and can make faster, better informed decisions. Using a camera and other sensors, the dashboard holistically tracks the baby's development and progress and monitors environmental factors including temperature, noise, and light levels. Events that need to be addressed first are highlighted. Caregivers use the platform for connecting with each other to discuss, plan, and agree on the best actions, and then use the scheduler tool to jointly plan daily activities. A simplified care schedule is shared via the Family Hub, a user-friendly interface that supports family engagement. Parents can peek in at their baby, view a progress tracker, watch educational videos, and communicate with caregivers. The adaptive environment changes according to the situation, supporting families as they provide care for their baby. From the first moments until it's time to go home together, making life better for all parties through meaningful, human-centered innovation.
So again, this is an aspiration, right? This whole thing is not pulled together yet, but I hope it gives you a sense of where Philips believes we are going. What are the opportunities out there? There's so much more that we could be doing. And it's hard to pick our heads up from the day-to-day when we're just literally reacting to everything that's in front of us. But design gives you an opportunity to project out and to really get into a future state scenario. So the last thing, if I could leave you with one thing here, I think designers come in all forms and backgrounds. Architects are for sure designers, visual designers, business analysts are designers, doctors and nurses are designers. If design is really, truly just a powerful process and method for complex problem solving, we all have a voice at that table. All of our points are valid in that. So I would say, as you go into the rest of the day and we get back into sort of the nitty-gritty, what is it that you feel like you are designed to do? What are those aspirations that you have for your hospital? What are those aspirations that you have for your organization? And how can you put those things into real use? How do we get ourselves there so that we're left feeling purposeful and empowered, which is what we hope for all of us really at the end of the day. So thank you for your time. I appreciate it. I'm looking forward to talking with you all more, and have a wonderful day.
Thank you so much, Ms. Mosby, for enlightening us on the importance of design in healthcare. I would request you to kindly stay up on stage, and I would request Mr. Sanjay Kumar, Joint Director, Architecture, Ministry of Defense, to kindly felicitate Ms. Mosby.
Do not know the protocol.